On the panel today is Riddhit Mitra, Senior Director, Global Product Management for Robotics at Smith & Nephew. Welcome to the panel.
Thank you so much for having me here today, Jenny.
You're most welcome, and we're delighted to have you. So in terms of precision, Riddhit, robotics can provide surgeons with enhanced dexterity and precision. So can you tell me about why that's important and what this means for the reproducibility of the outcomes?
And the reason why we are seeing robotics grow so fast in the space of orthopedic is fundamentally because of the need of precision in surgical care, especially when we think about knee surgery, hip surgery, where every patient is different. And for every patient to get back to the livelihoods that they're willing to see for themselves, it is very important to have high levels, high degrees of precision when surgeons are able to cut bone, preserve soft tissues, and replace it with high precision implants to help patients get back to their lives. And this precision requirement has been there from the very onset of surgery that started almost half a century ago. And to get that precision, surgeons have continuously evolved the care that they can provide with instruments, with tools, with calipers, but that gradually moved to a world where came computer-aided systems like navigation, where surgeons could see with tools where they are in space and how much bone they're cutting. However, that didn't give them any control over how much bone they were truly resecting. So that still left room for error. Where robotics really started picking up is to have tools that provide hyper precision in the hands of customers, in the hands of surgeons, so that even if their hands deviate a little bit, that micro motions are captured and protected in safe boundaries by robotic systems. And that level of precision has helped show that patients can A, get back to recovery faster, B, have better outcome scores, and C, just get back to living life the way they want to with robotic assisted surgery.
Thank you, Riddhit. That's really interesting. I guess something that you said really sparked a thought, which is around this data management and analysis. You talked about navigation there and all of the information and the consistent sort of feedback through the process as the surgeon proceeds through the actual procedure. That requires a lot of data management and analysis. So how is that protected, and how are things done differently in the context of needing that level of data for these procedures now?
Yeah, Jenny, that's a fantastic question. The whole world of orthopedic surgery has been based on clinical literature, on science, and on data. As we look again from the past to where we are today, the techniques, the methods of how to do good surgery has evolved in the hands of pioneers and leaders in this industry of orthopedic surgeons, of clinicians, as well as the industry leaders who have built solutions in that space. But it all depends on the type and fidelity of data we've been able to collect. And based on that data, the industry along with surgeon partners have together built techniques that say this boundary condition gives a good outcome for a surgery. But now what we're able to do with artificial intelligence, with data analytics, with machine learning and deep neural networks is look deeper into data that comes from computer-assisted systems, from robotic systems, and really understand the nuances in three-dimensional space from patient to patient. And in that world, we're able to capture three-dimensional data of not just bony structures, but ligaments and how knees can move, how hips can articulate, what activities of daily living can patients go through, and what are they desiring. And we can have simulations on top of those to see exactly where could a prosthesis implant fit to maximize the outputs for that particular patient and give them the life that they're looking for. And with these types of platforms that can not only collect, but analyze and provide this data back to surgeons to look and understand what could they personalize for their patient's care, they're then able to take that data back into their operating theaters and have this closed loop of learning through which they can execute that personalized plan for their patients with robotic-assisted systems.
Thank you. That's really interesting. And I guess something that you mentioned there was about being informed before they go into the procedure. So they actually take information in through the planning process. And from that perspective, there's less surprises, if you like, during the operations. Does that mean that you can reduce those surgery times? And obviously, that's of a clear advantage for the surgical centre. But can you talk to me a little bit more around what those advantages to the centre are, but also the implications for the patient in context with that?
When we talk about technology, technology is not just in the intraoperative realms of robotic systems, but it also starts from the point of care provision, which is the end-to-end spectrum of preoperative care to intraoperative to postoperative. And even in the preoperative world, there are so many solutions to get high fidelity data and high fidelity information. For example, there are mechanisms for us to get MRI scans, CT scans, and reconstruct 3D models of the patient's anatomy. Now, these solutions can sometimes be expensive in certain markets and can be time consuming if you look at an end to end procedure. In certain instances, depending on the right profiles of patients, having image-free solutions might be the right solution. However, in certain instances where there might be complexity in the geometries of the patient, just something different in their personalized care that they need, preoperative imaging can add so much more value. A great example of that is in hip replacement surgeries. The relationship of our spines with our pelvis leads to a role that it plays as to when we are sitting and standing, how does our hip move in relation to our spine? And that has an impact on how you want to put your implants in. To get some level of preoperative imaging, to be able to assess that, judge that, and then personalize plans so that people can get back to their activities of daily living can really help reduce the amount of time that a surgeon is spending intraoperatively to care for such complex deformities and complex procedures. The same can go for even complex procedures like revision surgeries, where for revision surgeries, it's hard to get preoperative imaging because there's going to be scatter because of pre-existing hardware in the knee or the hip. However, if you do those surgeries intraoperatively, the time with robotics is reduced drastically in such procedures because you're getting that level of three-dimensional information intraoperatively. So there is a space for image-based solutions in the preoperative world, and that's personalized to the care that patients need. And if we can segment that the right way for our surgeons so that they can use the right modalities of imaging, right modalities of 3D reconstruction for the right patients, I think that is the direction that technology and enablers will take further into the future.
Thank you. You talk again, and it's something that I'm coming back to because I've heard it through a number of the things that you've spoken to me about today. And that's this data management side of things and the fidelity of data. So in terms of that expectation, how do these centres sort of protect themselves in terms of the volume of data that they need to hold and aggregate and shift and learn from, and also this need to kind of feed this information set into sort of the wider healthcare understanding of these disease that the procedures are designed for? How do you manage that, and how does the organisation take a look at that, and how do we give patients confidence that their data will be utilised and protected in a safe environment within these healthcare facilities?
Data privacy and compliance to data rules and regulations is one of the paramount focuses that organizations like ours have. But in that zone, it is also about the collaboration that industries like ours can have with hospital centers in the right, meaningful, compliant regulatory ways and share data. Because as we look at progress, as we look at innovation that has happened, it has always happened under the boundaries of collaboration between industries, hospital centers, surgeons, working together and bringing solutions together from that perspective. But that has to be done compliantly, and that works only when patients are willing to share data, surgeons are willing to share data, and the industry is willing to share data. And together, when we collaborate in the right realms of what data is meaningful to bring the right solutions to further the care that we can provide. I think that is a realm that continues to evolve and is a realm that we are all responsible for making sure that we protect and keep the data safe, harbor it in compliant manners across the world, and yet innovate that can better patients' lives.
So Riddhit, you're saying we can increasingly be more confident around how our data would be managed and democratized, and that's really valuable to healthcare going forward. But if we were to talk about the future and the next step for robotic surgery, can we envisage the autonomous robotic surgery, as in there would be no clinician involved in the actual procedure? And if so, what would be those considerations in this evolution? And are there specific procedures that we could see it happening for first?
As we look further into the future, as we look at our advancements in technologies and as we look at how technologies have shaped and continues to shape healthcare, it has all been in the pursuit of excellence, in the pursuit of optimization, as well as just furthering the benefits of patient care to the maximum outputs that we can provide. As an industry, as well as we see that from our surgeon partners. But as we look further into the future, do we see a role of autonomous systems coming into play? And the way, at least we look at it, is there is a space for autonomy to come in the surgical space, but that too within the boundaries where we as patients can feel safe and secure as we take those steps forward. There is something very personal, very deep of having our care in the hands of surgeons, of humans who've trained in that space. And we believe that that personal touch of having someone who can hold our hands and take care of us is going to always exist for us as we look into the near midterm future. But for them to provide the care, if there are elements of autonomy that can help in the end-to-end spectrum of care they can provide, that can optimize their care pathways, in those levels of autonomy or autonomous robotic systems, we see some elements coming in and playing. But to have a completely autonomous surgical procedure might be a little further out. That there is no surgeon involvement. However, there could be elements within the procedure that could be completely automated while the surgeon is still there taking care of patients. So we do envisage a future in that direction, of course, when balanced with costs and optimization from that perspective.
So Riddhit, thank you for that. I mean, we've talked about precision surgery, we've talked about the real value to the patient in terms of reproducibility of the outcomes. We've talked about the real value all of this has in terms of how we actually plan for procedures and that it aids navigation with all of the information that can be gained in advance. It also leads, as you said, to reduced surgery times, and it means that more and more procedures can actually be done. So for those patients and for the likes of myself who do plan to live a much longer life and potentially have some additional problems as I go through that life, it's good to know that the robotics and the assisted robotics is actually advancing at such a pace. So thank you very much for your contribution today, Riddhit. It's been lovely to have you, and you've really added value to my knowledge and to everybody else on the call. Thank you.
Thank you so much, Jenny, for having me. It was such a pleasure.